Hello, this is Matt and Deb again from Marshbrook Rehab, and today we're going to be talking about knee pain, otherwise known as patellofemoral pain syndrome, and that basically describes pain kind of anywhere along the front of the knee here.
So this is the knee. So you have the femur that comes down, you have the tibia below it, that's the weight-bearing surface, and what you have is the alignment of these two. Think of it as creating a track. Then you have the quadriceps tendon that comes down, right? Your quadriceps muscle in the front of your thigh comes down, creates the quadriceps tendon, which crosses the knee and attaches below it, and your kneecap or your patella sits within the quadriceps tendon here. So as you bend and straighten the knee, this patella glides within that groove or on that track that's created by your femur and your tibia. It's a nice little system.
So what can happen is if that track becomes malaligned underneath the train, say, then we can start to get abnormal pressure built up along the under part of that kneecap area. Now this can often result in pain around the knee region. There are different factors that can influence how that track is set up, and it may be coming from above the knee at the hip joint, or it may be coming from below at your foot and ankle area. So if we look at Deb's knee here, a good alignment
she's
looks like versus what a less than favorable alignment would look like.
So there's pretty good alignment in my knee now, and as I land, if I were a runner, bending it and then straightening it again, I have good alignment between these two bones, my kneecap sitting in between and gliding on the track appropriately. The track often gets malaligned in an inward or medial direction like this. So when I land now, I'm doing this, coming inward, and then coming back out again as I straighten. So you can see that track is malaligned this way. The kneecap is now putting pressure toward the outside, running along that outer track with a lot of extra pressure that shouldn't be there. So why does this rotate inward is often the question. So as Maddie said, sometimes it comes from up top and is affecting the knee. Sometimes it comes below and is affecting the knee. So I'll talk about the below part. So if my foot is not in neutral, but is in fact overpronating when I run or curving inward, that arch caving in, as you can see as I start to come down and I have good alignment, once I cave that foot in, that's what makes my knee come inward. The other factors up top, and Maddie, what's that all about?
Well, so our musculature in our glute area and in the outside of the hip, if we're not firing that correctly, or if it's just not strong enough, or as we get deeper into the event that we're running, maybe we fatigue out in those areas, what can happen is as you're landing and you're accepting load through the joint, again, that can start to move in medially, causing that collapse inwards. And over time, this can cause compression here, tension over here, but somehow just manifest as pain. So when you come in for therapy, what we have to do is try to find what's the cause, what's the biggest contributing factor, and that will help us treat it.
So if you're having anterior knee pain, you want us to evaluate you, come in and see us, and we'll figure out what's going on.
Thanks for tuning in.